So, talk to Sylvia over here in Kalinga. Only two active dentists in all of Kalinga. Dr. Cho, जिथे Sylvia काम कर दिया, and so they send to Children's Surgery Center in Fresno, or Kids to Children's Choice, or Kids to Dentist in Visalia. So they make the patients drive. So for sure, will be the best one here in Huron. Okay, back, and there's only two active dentists in Kalinga, so potentially we can have all those kids, all Huron, all Kalinga kids, which is great. Avenal they're gonna send to their place in Hanford. So unless you have to do a lot of advertising in Avenal to get them to come, but it is doable. Medical, where to send your kids, and have free food there, and then it's game over. Okay. Um, Chinku said you want two or three quiet rooms. Okay, two or three X-ray rooms so you don't clog up the space. And he has a handheld digital X-ray to X-ray everything. Okay, that way it doesn't waste time. You move it around. Okay. Hallways, thick walls, and doors are good in case a kid's screaming or crying. They're able to handle them. He does nitrous plus the liquid. Aria does nitrous plus the liquid, and the liquid they give the stronger liquid. That's hot. It's dangerous liquid. Kid might not wake up. Okay, he says we don't only make $40 from Medi-Cal on the sedation. He makes almost 500 an hour is what his gross. He tries to do 500-hour gross. Okay, so take away the girls assist the 24 an hour the assistants. It's a lot cheaper. Especially we have workers from Huron. It's even better because now they'll be cheaper because they don't have to drive and they can go home for lunch. That's a really big benefit. Um, no nitro. Yeah, so that'll be good because I only do 20 procedures. That's it. I mean, and I do them over and over and over again. Okay. Um, you got to be close to a hospital in case something happens. You got to really know your the workup has to be done really good. And he said a spouting whale gets harpooned. That means don't show off, don't talk too much. And number three, he said a owner's eyes keeps the horse fat. So if you have a good owner, or the owner's there watching all the time, then no one can screw you. No one can take your money. That's very important. Um, what else? Uh, it's good to record these things prior of forgetting shit. So yeah, X-rays, pano, all that. They do accept Medi-Cal. He says don't do the private and the PPO. You can, but they're a lot more people are more nosy and stuff. You get to charge more. But he's saying, okay, you don't have to be board specialized because if you board specialized and GP get paid the same amount, it's not a problem. And he has those nice big metal bars that he uses to close the door and open the door, like a cup, right? Like the non hand. You don't have to turn the knob. You just kind of swing it open and close. Thick doors, so there's no sound. And he calls on Andy Boy. He doesn't say A, B, J. What are we doing on this? What are we doing that? He names it. C is cat. You're working on tooth number A. It's Andy. B is boy. That way, no one can get confused. Another thing we notice is before the kid's all crying and stuff, and the mom doesn't hear the kid crying, then what they do is keep the kid kind of quiet. Uh, they make the kid really get quiet. Okay, does it mess with the kid's psyche or no? What you say, they remember. What you do, they don't remember. So we put him down on a pampoo's board, give him some nitrous, give him some oral conscious sedation. Quickly, you got to be fast. You can't let him go down too much. So what the Jinku was doing is he would just work up. One room, look at the medical health history, worked it up. Second room treatment. Came back, one room, do the workup. How are you? This, that. Okay, any anemia? Okay, any blood conditions? Okay, heart is okay, any allergies, and then put them into the next room. Kids that can't move, don't have muscle tone, he still worked on them. When he pushed the stainless steel crown in, he kind of pushed it up pretty hard into their mouth. So that was a good thing, pushed it up into their mouth hard to set that up. I said you want Mexicans because they're thankful and they're humble. No English is even better. All right. Habla ta boca. He did learn he did speak Spanish. He was in it since 1998, 1998 or 89. I don't know if he's at it. And yeah, kids dentals where the money's at. GP, he said, okay, well, how long does it take you to do a crown? Okay, then on top of that, what's your lab fee? So you don't make anything per hour. You're barely at 100 an hour. Then you got to take your expense. He goes, Pito's better. It's 500 an hour. It's what he likes to be at gross. So 5,000 gross a day. So even if he does the work, he puts 2,000, 2,500 in his pocket. Not bad. You know, that's his system he wants.